Despite more than 2 decades of independence, access to healthcare services remains a challenge for rural communities. For almost 20 years, the Mission Aviation Fellowship has provided vital support, transporting patients by air to the National Hospital for treatment.
Accessing emergency health care remains a challenge for rural communities. Carlos Bere flew from Suwai to Delhi for treatment.
Today, I traveled by aircraft to have treatment in Delhi because the doctors in Suwai did an ultrasound and the result shows that I need surgery. But they don't have a doctor to provide the service, so they sent me here for surgery and treatment.
Mr. Berek had to pay $50 for a one-way flight.
I am unable to drive for long hours, so I decided to fly with the aircraft and cover the cost myself.
Since 2007, the Ministry of Health has had a cooperation agreement with the Christian organization Mission Aviation Fellowship to provide critical transport for rural patients. But not all patients are funded by the government for air travel. It must be an emergency and need immediate evacuation.
Critical cases such as chest trauma and maternity cases such as postpartum hemorrhagic that cannot be treated in referral and regional hospitals, we must evacuate immediately to the National Hospital to get advanced medical intervention and treatment.
19 patients have been transported by aircraft to hospital in the last 2 months. Recently, the emergency and medical team provided first aid training to aircraft workers.
This one-day training for the MAF aircraft employees, the aircraft that Ministry of Health has contracted to evacuate patients from the municipality to the Giri Valadares National Hospital.
In the past, it was more us giving the training, but today we are receiving a first aid training from the ambulance teams.
For nearly 20 years, the Christian organization Mission Aviation Fellowship has provided critical transport for patients.
Specify that our partnership has grown over the years and it will continue to grow, and as we continue to serve the people of Timor-Leste, we believe that our partnership will strengthen and it will help the people in the community.
Mr. Domta says that ongoing conflict in the Middle East has led to inflation, requiring a price increase to sustain their operations.
There's inflation and price keeps going up, so we understand SNIM's position, but also for us to keep running it this year we had to increase the cost a little bit, but we won't keep it as a surprise, and then we keep the communication, so whenever we see that we will be increasing the price, we try to give them an advance notice so that they can also incorporate in the budget.
There are 3 aircraft operating in the country to evacuate patients from rural areas to access health care. And there are plans to get a bigger aircraft to overcome weather challenges and make evacuation services available to more people. In the 2026 budget, the Ministry of Health allocated $240,000 to help flying very ill patients in rural and remote Timor-Leste to hospital. Pauline Quintan, Flavio Barros, RTTL World News.